Hey guys, so in today's video, I wanted to talk to you about what just happened at my doctor's appointment this morning. So to give you guys a little bit of backstory, um, I have to go see my doctor on a regular basis because of one of the medications that I'm on. The gabapentin that I take for nerve pain. Um, yeah, I have to see him every 3 months because of that. And so I was going in today for a normal checkup on that anyway. And lately, as you guys know, I've been trying to lose weight. Well, I've been trying to do more walking and being more active and doing the snowshoeing and things like that. Obviously now the snow is melting, but um, I noticed that as I was walking and doing snowshoeing activities and things like that, my hip has been hurting really bad. And along with my back, which always hurts because of an injury that I received doing CNA work on the trach unit. So anyways, I decided to bring it up to my doctor this morning since I was going to be there anyway. I figured why not just bring it up, get it out in the open, maybe he can help me. And so he had me do some motions in the office, like because he was trying to figure out where the actual problem was on my hip. And so he gave me this whole paper, and this is what I have. So I don't know how well you can see that, but Trochanteric Bursitis is what he says I have. And let me just read what it is to you guys in case you're curious. And then I will tell you like what his recommendations are and what the treatment plan is that he is having me do currently. So, Trochanteric Bursitis. So the hip has a large prominent bump along the outside of the thigh bone, which is known as the greater trochanter. Many of the muscles that move the hip joint connect to this bump through tendons. A fluid-filled sac, which is the trochanteric bursa, acts to lubricate the different layers of tendons and allows them to glide past one another. The iliotibial, or IT band, is a long, tough band of tissue that runs from the pelvis past the trochanter of the hip all the way to the outside of the knee. Trochanteric pain is often caused from irritation of the trochanteric bursa and surrounding tendons on the side of the hip. A patient with an arthritic or replaced hip can also experience pain in this area. In rare cases, the pain can be caused from a torn tendon or be related to pain from the low back. Today, these conditions have been grouped together and are now called Greater Trochanter Pain Syndrome, or GTPS, which is what he says I have. So he gave me this little thing. It has all sorts of exercises that he wants me to do, like different stretches and things like that. And I have to go back and see him in July. But what he wants me to do for now is to do these stretches, try to be as active as I'm able to without like causing worse pain on that hip joint. And he also started me on a stronger anti-inflammatory medication that he wants me to take religiously, is how he said it. He wants me to take it religiously once a day for a few months so that he can see when I go back to him how it's doing. He said hopefully it's better. If not, then he is planning to refer me to see or to do physical therapy. And then he said at that point, if it's not better, then he would also inject the bursa itself with a corticosteroid injection. So I'm really not trying to get to that point if I don't have to. So I'm going to be doing these exercises. He gave me a few different ones that he wants me to do every day. He said some of them may be easier than others. And he did print off a couple of different ones, like these ones he printed off because they have pictures and they're mostly just stretches. He said that when he was evaluating my hip this morning, he said he can feel like how tight that hip is, and it's my right hip that's having a lot of pain. And I told him, you know, I've been trying to be more active and get outside more and walk, and you know, I'm trying to lose weight. And he said, well, that's good. And he actually said, you know, you don't really need physical activity in order to lose weight. Your diet is everything. And I said, I get that, but you know, me personally, I feel like I do better when I also throw exercise into the mix because I feel more motivated to eat right, if you know what I mean. Um, so yeah, I'm doing that, and I probably won't get that anti-inflammatory until Monday because I'm done working for the week. And yeah, so I'll probably get that on Monday and start that on Monday. And then I go back to see him in July. So I'm hoping by then these stretches will help. Swimming should help, hopefully loosen up my hip a little bit. It's just kind of frustrating because it's like you're trying to get other aspects of your health better, like losing weight and, you know, being more active and living a healthier lifestyle. But in the process, you experience other difficulties. And like I said, I'm really not trying to have to get steroid injections in my hip if I don't have to. So I'm going to try what he says. And I also have to talk to him. I'm going to have to call his office back because trying to get hooked up with a neurologist in Michigan, my insurance requires that you have a referral to go see the neurologist. And they were actually supposed to call in a referral months ago, but I will talk more about that in a separate video, just kind of explaining that situation. But I have to call them back because, excuse me, there was a mix up there. So that's what's going on. I'm dealing with Trochanteric Bursitis, or Greater Trochanter Pain Syndrome. And he's hoping, like I said, that the anti-inflammatory that he prescribed is going to help with my back pain as well. He kind of asked me, you know, why I hadn't gotten it looked at before now. And I told him, you know, my doctor in Indiana was trying to set up like an x-ray and all that kind of stuff to figure out what was going on with my back. But, you know, because of insurance issues, I wasn't able to get it done there. So anyways, I just thought that I would explain to you guys what's going on. It wasn't like super bad news from the doctor or anything like that. It's just I have to do these exercises so that hopefully I can get more active and do the things that I want to do. So with that being said, that's all I have for this video. I hope you guys enjoyed. Stay tuned for that other video talking about like the neurology issues and things like that, because I will make a whole separate video talking about those issues. So I will talk to you guys next time.